Good morning, everybody.
Please go ahead, sir. Good morning.
So I'll be presenting about the comparative analysis of the cost effectiveness and the vision, and especially in cases of it's going automatically. In the open loop haptic premium multifocal toric versus economic model of multiforic toric IOLs in Indian population. Our co-authors are Dr. Bharti and Dr. Nidhi. What is the purpose? The purpose of the study was to compare the cost, degree of IOL rotation, residual spherical equivalent, and astigmatism, binocular uncorrected distance and near vision, reading speed on M1 Read app, patient satisfaction and bilateral implantation of premium open loop haptic multifocal toric IOLs versus the economic multifocal at 90 days in Indian population. The method was it was a non-randomized and comparative study which included 100 eyes of 50 patients each. The outcome parameters that was to be compared was the cost, the degree of IOL rotation, residual spherical and astigmatism, binocular uncorrected distance and near vision, binocular photopic and mesopic contrast sensitivity, and photopic phenomena, and reading speed on MNR read app at 90 days of follow-up. We included these cases that was between 50 to 75 years. Corneal endothelial cells count had to be greater than 2,000 cells per square millimeter, and power of IOL implanted were from 20 to 23.5, and rest were excluded for a better comparison, and it had to be in the capsular bag implantation. We excluded these cases which had a previous ocular trauma or intraocular surgery, irregular astigmatism, corneal dystrophy, history of glaucoma or intraocular inflammation, macular diseases or retinopathy, neuroophthalmic diseases, intraoperative or post-operative complications. So when we compare, as for the genders, there was no gender discrimination. It had no difference. The age, they didn't matter. There was statistically no difference. And when we compare the pre-operative data of all the eyes, the parameters like a spherical equivalent, the K1, K2 readings, the axial length, there was statistically no difference pre-op. And when we saw the distant vision correction, corrected, it was comparable, and statistically there is no difference, and so was the near vision. It had no difference. Now the spherical equivalent, the residual astigmatism and IOL rotation, it had a difference of means of 0.4, 0.08, and 0.77. So it was also statistically no different. Contrast sensitivity in mesopic condition and photopic condition in 5 CPD, 10 CPD, and 15 CPD reveals that it was comparable in both the groups and statistically not significant. And this was in the mesopic condition, it was non-significant. So as for the photopic conditions are concerned, like glare, some had none, some had mild, and some had severe, and they were from 70%, 20%, 10% respectively from non-mild to severe, and it was non-significant. And in the halos also, it was non-significant if compared with the two groups. If you go for the reading in the that chart app, so reading was for the equity size, and it was for the speed with the same size and the flow of the speed, flow of the reading, and again there was a maximum reading speed, that is MRS. The size was not a consideration. So with this app, when we compared both the groups, there was statistically no difference, and these were the result. It shows that statistically there is no difference when they were compared with the MNR read app. So, but as far as the direct cost is concerned, there was a very heavy difference. So we conclude that despite of highly significant difference in cost, both the premium and economical models of multifocal toric IOL showed comparable clinical effectiveness. And what it adds that economic model available in India for multifocal toric IOLs provide a much cheaper solution to a large group of middle class Indian population suffering from cataract and astigmatism, which needs spectacle-free vision for distance and near vision. Thank you very much. I'm proud to be Indian. Thank you.
Thank you very much, sir. May I request our judges if you would like to ask something?
What are the toric multifocals multifocal torics you have used in the study?
Two types, sir. One is Alcon type and one is biotech type.
Okay, biotech trifocal.
Yeah.